Welcome to my page. This is Dosberry, New Life Clinic and Maternity, Akabo. I said cryptic pregnancy in Nigeria is scam, is adoption in disguise, yes. Because we know that placenta has just 40 weeks to stay, to sustain pregnancy, to sustain the fetus. And after 40 weeks, it will begin to degenerate. All right. So what happens that someone will come and tell you that I carried pregnancy for 2 years, I carried pregnancy for a year and 6 months, I carried pregnancy for 10 years. The smart question you should ask is, what is sustaining that pregnancy? What is sustaining the fetus? Having known that it is through the placenta that the fetus takes in oxygen, the fetus takes nutrients, transportation, elimination process, all these things takes place through the placenta. And now it is just 40 weeks that the placenta has to stay. Now you carried pregnancy for 1 year. How come? How did it happen? It is high time women should open their eyes. When you are desperately in need of a child, when you are desperately in need of a baby, you are desperately in need of having children, conception, you should be very careful, because a lot is happening, a lot is going on in this country. Things are not regularized, things are not monitored, there is no system working. So if you want to go for pure adoption, please do leave this story of cryptic pregnancy. I had one patient then. She was coming from what is it, boundary between Imo State and Anambra State. She says she is almost ending her life because she couldn't continue with what she started. That she has been pregnant for the past 5 years in Anambra. That's where she went to do her own. And when she had no money to continue the funding, the woman told her she's not going to deliver, and she began to swell up. So it was the fear that got her. All right. She now started looking for me. She said she has been hearing my voice on the radio, which station, either Echo, Darling, or My Radio FM, that she heard me teaching. That was where she called the radio station and they gave her my number. All right. When she came, honestly, what she was fighting or battling with was bloated abdomen. She was battling with ulcer. But the fear they instigated in her made her so uncomfortable. First, we started with psychological reassurance, making this woman to accept herself that she wasn't pregnant. It was only then she opened up and told me what she has been passing through. All right. Now you are collecting millions of money. Someone said she paid 7 million for twin, and 15 million for twin gestation, and was like, oh man, it worked. Oh, if you see me now, when I started telling that woman the consequences behind what she just did, she was shouting. A lot of women are having cancer of the cervix, cancer of the uterus, cancer of the vagina, cancer of the breast, cancer of the lungs, cancer of this and that. We don't consider the factors influencing this cancer of a thing. All we know is that we want to have children. Then you have to do everything at any possible means for you to have a child. Having an adopted children, there is not a wrong idea. It is not. At least when you are going for adoption, you go through a process. You have to screen the baby. You must be sure of what you are going for. But when you are doing cryptic, it is a criminal act that you don't even know where that baby came from. All you know is that they have manipulated you. They will go to the point of even giving the woman a episiotomy. I heard recently that they are even doing cesarean section on women for this their cryptic criminal act of getting children. Now, look at this story. While I was in the emergency pediatrics unit, there is one woman that came, a desperate woman that came with a newborn. According to her, she said that child was 3 weeks old, but that child was like 3 months old. What happened? Why was the child looking so unhealthy? Because the child was suffering from HIV without that woman knowing it. When she came in, I received them. My HOD was like, hey, see, your patients are here. I said, yes, so let's see what they have today, because they are wearing apron, these church people. So when that woman came, I told her, madam, you have to do this and that and that. She said, you people are stressing me. We are going to do HIV test, short in. Madam, can you breastfeed malnourished, underweight child? Can you breastfeed? She said her breast milk stopped 2 days following delivery. She didn't even lactate. All right, we have our means of expressing breast milk. They called me and say, this one is your field. I called the woman to come and sit, and I offered a seat. She sat. Okay, can I please assess your breast, please? The woman brought that breast was as flat as my grandmother's breast. Now, assessing the breast, there is no symptom, no evidence, no sign of pregnancy, not to talk about lactation. I grabbed the breast and began to do the needful. There was no breast milk coming out. Madam, are you sure this child is your child? I trust my HOD then. That woman don't give shit when you come with lies of this cryptic pregnancy. The woman said, yes, I gave birth. This is my, even they gave me tear, they gave me cut, they did this and that. Why are you not lactating? No problem, let us overlook that one and face the newborn. You said this child is 3 weeks old. Yes, we did our examination. That child was more than 3 weeks. Yes. And now HIV was positive. That was when the woman began to shout, they will balance me my money. She quickly left emergency pediatrics unit, forgetting her apron. I ran to her and called her. Madam, come and pick your apron. You are still having something. You have something you are leaving in our office. Come and pick it. When she came back, the HOD was, Oya, calm down. Who are you referring to? Who are the people that will balance you? Is it our unit? She said no. Where she got, that was when she opened her mouth to say she did a cryptic pregnancy procedure. So have you seen the risk? But if you are going for adoption, trust Nosberry. If I should assess a baby for you, you are okay with that. It takes the grace of God for you to adopt a reasonable child. And I was telling somebody that me, as I am, I can't go to an orphanage home and adopt a baby. I have my reasons with me. One, I'm scared of having a child with HIE. I have explained what HIE means here. Hypoxic ischemic encephalopathy, unfortunately, is what they are calling special needs children. Two, you can adopt a child with mental problem like epilepsy. You can adopt a child with all these congenital deformities and all that. Finally, what will happen? So when you are talking about cryptic pregnancy, ask yourself, that pregnancy you said that lasted for 2 years, what was really sustaining it? Having known that the placenta is the source of energy, nutrients, and oxygen to the child, and its lifespan is just 40 weeks. So any pregnancy that is beyond 40 weeks is considered invalid. I love you all. Please do wait to subscribe to my YouTube channel. We are going to take you up on health related discussions. See you soon.